Good day, everyone. We are Group 2. I am GANI, and I'm here together with my group members, together with Miss Evangelista, Mr. Fabrigas, Miss FALGUI, Miss GABIA, Mr. GABO, Miss HASSAN, Mr. JAYOMA, Miss JOAQUIN, and Miss LABISTE. We would like to share with you our group presentation entitled Preventing and Managing Hypertension Through Lifestyle Modification Using Pender'S Health Promotion Model. Together, we selected this current health issue to emphasize the increasing cases of hypertension in our communities and the crucial role that lifestyle changes play in both its prevention and management. By applying Pender'S Health Promotion Model, our goal is to raise awareness and guide effective nursing interventions focused on health promotion and behavioral changes. But before we begin, here are the learning objectives of our presentation. By the end of this presentation, student nurses will be able to, first, to identify the target population and significance of hypertension as a health issue in the community, to describe the core concepts and constructs of Pender'S Health Promotion Model, to differentiate Pender'S model from another health promotion theory based on focus, application, and strengths, to apply the constructs of Pender'S model in designing a health campaign for hypertension prevention and management, to recognize the potential impact of the campaign on improving lifestyle behaviors and reducing hypertension risk, and lastly, to evaluate how theoretical frameworks guide effective health promotion strategies in nursing practice. Preventing and managing hypertension through lifestyle modification. Hypertension, also known as high blood pressure, is one of the most common chronic conditions affecting millions of individuals worldwide. It is a major risk factor for serious health problems such as heart disease, stroke, kidney failure, and premature death. In many cases, hypertension develops silently, showing no symptoms until complications arise. One of the leading contributors to the increasing prevalence of hypertension is poor lifestyle choices, including unhealthy diet, physical inactivity, stress, smoking, and excessive alcohol consumption. Although medications are available to control blood pressure, lifestyle modification remains the cornerstone of both prevention and long-term management. Public health initiatives and patient education efforts emphasize the importance of lifestyle changes in controlling blood pressure and improving overall cardiovascular health. At this point, I'll pass the floor to Ms. JOAQUIN to discuss the health promotion model.
What is Pender'S Health Promotion Model? Pender'S Health Promotion Model is created by Nola Pender, explains how individuals make choices about their health. It views health as an active, positive state and emphasizes personal involvement in well-being. The model has three main components. First, individual characteristics and experience. Second, behavior-specific cognitions and affect. Third, behavioral outcomes.
Now, let's discuss the three main components of Pender'S Health Promotion Model. First, we have the individual characteristic and experiences. This includes past behaviors and personal factors like age, biology, and psychology that influence health choices. This means that our previous actions, such as whether we exercise regularly or had unhealthy habits, can affect our future health decisions. Personal factors like our age, biological makeup, and physiological state also plays a role. One example is that an older person may have different health needs compared to a younger one, and someone with a positive mindset may be more motivated to make healthier choices. Second, we have the behavior-specific cognitions effect. It focuses on beliefs and feelings about health behaviors such as perceived benefits, barriers, self-efficacy, emotions, and social influences. This refers how we think and feel about our health habits. For instance, if we really believe that exercising well benefits us, it's more likely to do it. On the other hand, if we feel there are barriers like lack of time or money, we might avoid it. Self-efficacy is our confidence that we can carry out a health behavior, emotions, and the influence of people around us, such as family or friends, also shape our decisions. Lastly, we have the behavioral outcomes, which refers to the adoption of healthy behaviors that lead to improved health and quality of life. This is the ultimate goals that putting into action all of our healthy choices we learned about when we adopt healthy behaviors, like eating nutritious food, exercising regularly, and managing stress. We improve not just our physical health, but also our overall well-being and quality of life. Next.
Next is Pender'S Health Promotion Model. Known as Pender'S Health Promotion Model focuses on helping individuals achieve higher levels of well-being by encouraging healthy behaviors. The models identify personal factors, perceived benefits and barriers to action, and self-efficacy as key influences on health-promoting behaviors. It emphasizes that individuals are not passive recipients of care but active participants in managing their health. The Health Promotion Model highlights the importance of prior behaviors and situational influences in shaping motivation and actions. Ultimately, it aims to empower people to take control of their health through positive lifestyle choices and behavioral change. Next is difference of health promotional model to other health promotion theory. Health promotion theory. Health Promotion Model by Nola Pender focuses on motivating individuals to adopt behaviors that enhance well-being, considering personal experiences, perceived benefits, self-efficacy, and social influences. In nursing, it is applied to encourage healthy lifestyles. Choices such as balanced nutrition, regular exercise, stress management, and routine checkups. Next is Health Belief Model. In contrast, the Health Belief Model explains health behaviors based on perceptions of disease, susceptibility, severity, and the benefits versus barriers of taking action, making it particularly effective in preventing health programs like immunization and screening.
So according to Pender, every person brings their own background into health-related decisions. So this includes individual characteristics and experiences, and also personal factors. For individual characteristics and experiences, this refers to a person's prior related behavior. It also includes personal experiences with health illness or lifestyle changes. These past experiences shape the current choices and maintaining healthy practices. So if a person is vulnerable to hypertension, these are the following characteristics and experiences that might make them vulnerable to such illness. First, we have history of unhealthy eating such as high sodium diet. Next, we have past sedentary lifestyle. And if the person has inconsistent medication or checkups, and also stress levels, as well as previous experiences with hypertension or other chronic diseases can be factors as well. Now for personal factors, these are the factors such as age, gender for biological aspect, and also for social-cultural aspect includes race, education, culture, and such. So we can determine that a person is also vulnerable to hypertension if they aged around 40 to 70 usually, and according to their gender as well might be the determinant. Also family history of hypertension, obesity, and also includes physical inactivity.
So good day everyone. My name is Kirsten Shane M. LABISTE, and today I will be discussing about behavior-specific cognitions and effects. So these materials explains how people's thoughts, beliefs, and feelings affect their health and related actions, especially for managing blood pressure. So perceived benefits of action. First is a belief that reducing salt, exercising, and taking medicines will lower blood pressure. Understanding that managing BP prevents stroke, heart attack, and kidney disease. So people believe that actions like reducing salt intake, exercising, and taking medications will lower their blood pressure and prevent serious health issues such as stroke, heart attack, and kidney disease. For example, a patient might notice that missing their medication one day causes their blood pressure to rise, which motivates them to take medicines consistently. Next one is perceived barriers to actions. So there are challenges such as the cost of medication, taste preferences, example, the love of salty foods or fatty foods, limited access to healthcare, denial of diagnosis, and lack of time for exercise or meal planning. So for instance, someone might find it hard to follow a low salt diet because they love traditionally salty foods or become healthy foods are costly. Next one, perceived self-efficacy. So this means having confidence in the ability to change diet, exercise, monitor blood pressure, and adhere to medications. So however, this confidence can be low if the person feels unmotivated or unsupported. For example, a person may struggle to maintain lifestyle changes if they don't feel supported by family or healthcare providers. Next one is the activity-related affect. So this is the emotional response to engaging in health behaviors. Some may feel enjoyment from group exercise or walking, while others may feel frustration from dietary restrictions. So for example, a person is joining a walking group and it might make the exercise more enjoyable. So while strict diets might create frustration. Next one. So the next one will be discussed by Miss Hassan.
Good morning, classmates. Now I will be discussing the last three parts of behavior-specific cognitions and affect. So we have interpersonal influences. This focuses on how people around a hypertensive patient can affect their health behavior. For example, family, friends, or even healthcare workers can encourage them to eat less salty food, exercise, or take their medicines on time. But sometimes, the opposite happens, like when barkada or co-workers eat together and everyone orders fast food. That kind of peer pressure can make it harder to maintain healthy habits. On the positive side, support groups or even church communities can also provide encouragement and accountability, which helps patients stay motivated in managing their blood pressure. Next is the situational influences. This is about the environment and resources available to the person. For instance, if a patient has a BP monitor at home, it is easier for them to regularly check their blood pressure. Also, barangay health centers that offer free BP monitoring or health programs make prevention and management more accessible. And location also matters. If they live near a market where healthy food is affordable, it supports their better choices. But if they are surrounded mostly by fast food stalls, it increases the temptation to go for unhealthy options. Now, lastly, let's talk about the prior-related behavior. So this refers to the past actions or lifestyle of a person that can affect how they behave in the present. For example, if a patient with hypertension has a history of eating a lot of salty or fatty foods, not exercising, or skipping medicines before, there is a high chance that they may continue those same habits unless proper intervention is done. On the other hand, if they already practice healthy behavior in the past, like exercising regularly or eating vegetables, then it's easier for them to maintain those habits. In short, Our previous behaviors influence how willing or capable we are to make positive lifestyle changes. For hypertensive patients, knowing their prior related behavior helps healthcare providers guide them better, since it gives us an idea of what habits need to be broken and what healthy ones we can build on.
Health behavior focus. Adopting a low-sodium, heart-healthy diet, limiting salty condiments like soy sauce, bagoong, or instant noodles, regular physical activity, engaging in at least 30 minutes of moderate exercise, maintain healthy weight, routine blood pressure monitoring, checking BP regularly at home or local health centers, medication adherence, taking prescribed antihypertensive medication consistently, stress management, practice relaxation to lower blood pressure, limiting alcohol and avoiding tobacco, reducing or eliminating alcohol consumption, quitting smoking and avoiding secondhand smoke, medication adherence, take medicines at the same time daily, set an alarm or place pills in a weekly pill organizer. Next, health promotion campaign title, BP ko, alerto ako. So, this is a culturally relevant health promotion campaign designed to raise awareness about hypertension prevention and control, especially in Filipino communities. The campaign encourages individuals to regularly monitor their blood pressure, make healthier food choices, stay physically active, and manage stress efficiently. It uses simple language, engaging social media content, and the barangay-based activities like free BP checks, nutrition seminars, and community Zumba sessions. The goal is to empower people to be proactive about their blood pressure and take responsibility for their heart health.
The goals in preventing and managing hypertension. First is to educate 80% of participants on the signs, symptoms, and risks of hypertension within 1 month. Then, encourage 70% of adults aged 30 plus to have their blood pressure checked weekly at the Barangay Health Center. This will allow us to promote regular blood pressure monitoring to identify and manage hypertension early. For the third one, promote daily low-sodium diet and exercise habits in 60% of households within 3 months. This encourages healthy lifestyle changes to reduce the risk and impact of high blood pressure. For the last one, increase medication adherence by 50% among diagnosed hypertensive residents within 6 months. This goal focuses on improving treatment compliance to better control hypertension and prevent complications. Using Pender'S health promotion model, these goals can be achieved by enhancing perceived benefits, reducing barriers, and increasing self-efficacy through education, community engagement, and accessible health services. Interpersonal support, enjoyable activities, and personalized interventions further promote sustainable behavior change in managing hypertension. And that ends our report. Thank you for listening.